Nicklaus Children's Heart Institute was created with a very clear mission: to provide the most advanced, life-saving and innovative care for children with congenital heart disease in South Florida. Today, we are recognized as one of the nation's leading pediatric heart programs, and we are ranked number 1 in South Florida for cardiology and cardiovascular surgery by US News and World Report. We provide comprehensive and innovative care across the entire lifespan, from fetal diagnosis to adulthood, combining world-class surgery, cutting-edge technology, and a deeply compassionate, family-centered approach. We are building and leading a program where clinical excellence, research, and innovation are fully integrated. And that means not only delivering the highest level surgical care, but also constantly pushing the field forward through research, new techniques, and new technologies. We work very closely with engineers, scientists, and trainees, translating ideas from the lab directly to the bedside. Through the Miami Congenital Heart Defect Research Institute, we conduct clinical trials, clinical outcome research, and translational studies that are shaping the future of pediatric cardiac surgery. Robotics and minimally invasive approaches are transforming how we perform pediatric heart surgery. These technologies allow us to operate through smaller incisions with greater precision, less trauma, and faster recovery. For children, that means less pain, shorter hospital stays, and better cosmetic results. One of our major areas of focus is actually to developing and implementing advanced valve repair techniques that allow children to keep their own tissue whenever possible. Traditional valve replacement often means repeated surgery as the child grows. But by refining innovative repair strategies and testing emerging techniques, we are actually improving durability, preserving heart function, and dramatically reducing the long-term burden of reoperation. And these advances in heart valve repair truly change the trajectory of a child's life.
I had my anatomy scan around 20 weeks with the MFM, and there they were able to detect some type of heart defect and referred me to the pediatric cardiologist. So there they were able to do the echocardiogram and then confirm the truncus arteriosus diagnosis. So we interviewed with different hospitals, and Nicklaus was one of them. And we spoke to Jessica, the nurse navigator, with Dr. Kalfa's team. And she navigated and was in communication with us throughout the whole time. And we got to meet Dr. Kalfa, and we had a consultation with him. We got a whole tour of the unit and where they do the surgeries and everything like that. And then ultimately, we decided that this was the hospital and he was the surgeon that we wanted to go with and trust with the surgery for our baby. Nicklaus offers a lot more, even in terms of like the parents staying here was a good plus. And you know, despite the fact that I was with my C-section recovering in South Miami, I knew that there was going to be slight delay, but there was something about coming to Nicklaus and something about researching Dr. Kalfa that we really entrusted. We are so happy that we decided to come to Nicklaus. Between the care with the nurses, the medical team, I feel that there's an open communication whenever there's an update, and the education too that they provide. Everything's explained. I just felt that it was exceptional care, and I still do.
Our collaboration with Florida International University represents a powerful collaboration between surgeons, engineers, and scientists. Together, we are developing a biostable, growth-accommodating valved conduit that can be surgically implanted to reconstruct the right ventricle outflow tract and later expanded as the child grows. We also develop a bioreactor which helps us to keep alive living valves for weeks and weeks. These NIH-funded projects have the potential to significantly reduce the number of repeat surgeries in children currently face and represents a true breakthrough in congenital heart surgery. The future at Nicklaus Children's Heart Institute is incredibly exciting. We are building and leading a program defined by innovation and research and education, where new technologies artificial intelligence, and advanced surgical techniques and computational modeling come together to deliver truly personalized care. Our goal is not only to treat congenital heart disease, but to transform outcomes for generations of children.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.